Guys, welcome back to Medical Coding with Blue. Today's episode is all about how to study with the 2024 ICD-10-CM Expert for Physicians from Optum. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So first things first, this is not an ad for Optum. However, I will say this. I am a veteran medical coder. I've been in the medical coding industry or health information industry for 16 years now. And so I know a thing or two when it comes to books. This is my own personal opinion, this entire video. And again, they are not paying me. Optum does not pay me. However, I will say that when it comes to having quality tools to work with as a medical coder, they are the best, okay? Now, there's very few that I will say they are the best, and Optum is the best when it comes to this. So if you are a student or if you are a veteran coder that needs to be reacquainted with your books, today's video is going to be for you. I will also say this. This is book week, so y'all are not going to see me, but you are going to see my books that I recommend, and I'm going to be talking about them all this week. So if you're interested, please continue to stay tuned. All right, so here we go. So the first thing I want to say is this. Everybody always asks me about this one. Blue, why does it say that it's valid from October 1 to 2023 through September 30th, 2024? Does that mean if I'm taking a test after September 30th, 2024, I can't use the 2024 book? Yes, you can, because what this means is every October 1 is our coding new year. That's the time of year that the new code set is released. So that has to do with when you're out in the working world and you're out there assigning codes and things. They have to have the new codes updated October 1. So if a code changed, and you're trying to submit a claim on October 2nd with old codes, the insurance is going to deny it because you're using old codes. So that's all that means. So if you are taking a test, do not worry about what this says here. Okay? Do not worry about what that says. All you need to be concentrated on is what year version do you need. And please do not ask me because whichever association you're going through, AHIMA, the American Health Information Management Association, or AAPC, the American Academy of Professional Coders, will have a list of the yearbook that you need and the publishers that you can use. But both associations do allow you to have your choice of publisher when it comes to ICD-10-CM. So that's why I say you can use this if you are taking this Optum book, if you are taking an AHIMA exam or an AAPC exam. Now, the other thing I will say is also this. There's some disagreement about, oh, well, no, expert is not. No, hold on. I have taken my medical coding certification exams. I've taken them all through AHIMA, done very well, passing the first time, and this is the book that I use. This brand, this version, okay? So that's all I'm going to say on that one. Everybody's going to have their own different opinions, but I am here as a neutral voice because whether you get this book or use this book or not, it doesn't matter to me. I'm just trying to help you guys to have good tools. Okay, so that's all I'm going to say on that. So here we go. So opening this book up, I will also say this also before I get into this. You notice how this book is clean? There's no tabs. You don't need silly tabs, guys. You do not. You don't. Because if you're using your book like you're supposed to, those tabs are going to get in your way. That's all I'm going to say. All right. So I'm going to skip this other stuff is like the content, table of contents and stuff. I'm going to skip all of this, the updates and things. If you're going through your book like you're supposed to, you'll have seen all those. Now, let's get into this first part. I always tell students to read the coding guidelines. You have to read the coding guidelines in their entirety once per week if you truly want to know what you're doing. If you truly want to understand, it's not going to make sense to you the first time you run through it. Maybe the first 5 times you run through the whole guidelines, it's still not going to make sense. But I guarantee you're probably going to have that light bulb moment the more you stick with it, okay? But if you give up on it right away, and if you say this does not make sense to me, I hate the guidelines, these guidelines are going to tell you if you're going to do your coding correctly or not. It is not just about looking up codes. No, it is about knowing which codes to look up because certain codes don't apply at certain times. And other codes are going to be sequenced differently depending on what drove the visit. So in order for you to understand that, This is where you got to start, is these guidelines, okay? Now, here in the book, in the 2024 book, it is 32 pages, okay? 32 pages in all, front and back, and it's double columned, okay? The whole way through. You can download these same guidelines for free on the CMS website. You can go to CMS, or you can just type into Google CMS ICD-10-CM Coding Guidelines 2024, and the PDF will be the first thing that pops up. And then you can listen to those, you can read them. I've already explained so many times how to listen to them, guys. Go through my videos and you'll be able to find it out, okay? But that's how you can get the current, if you do not have a current code book, okay? So here's 2024, these are the current guidelines, and you would have to read both of these and all, okay? You got to read all of it. If you need to, which you will, if you need to like break it down into like 30-minute sessions and not sit through the whole thing, you can totally do that. And you might be slow at first reading these guidelines, and they may not be your most favorite thing to do. But when you get to Section C of the guidelines is where all of the chapter-specific rules are at, okay? Let me go back to that one. So see here, the chapter-specific coding guidelines. These are going to be all the chapters in their entirety, and it's going to be special things about each of these chapters. Some of these chapters do not have anything, and some do. So they don't have any guidance, and some do. So you just have to go through it. And some of them, it's going to be because they have nothing to say. It's pretty well straightforward in that chapter. But for those that are specific on certain rules, like for neoplasm coding, you know, infections and things like that, it's going to give you all the rules. And this is your best way of working through any confusion that you have. Because a lot of people will write to me and say, Bleu, I'm so confused because I don't understand. Well, have you read the guidelines? Well, no. Well, that's where you got to start, okay? That's where you have to start, because these are going to be our rules. And again, it's not going to make sense unless you keep going with it, okay? So read through these coding guidelines. If you are in a coding program, you need to be doing this. This needs to be a regular practice once per week. And again, it may take you a few days the first time to get through it. It may take you 2 weeks to get through the whole guidelines. But I'm telling you, this is a good use of your time, because you are going to be so far ahead than your peers because you've been through these guidelines. You don't have to memorize them, okay? That's the other thing too, guys. Don't memorize them because you're wasting time. If you're trying to memorize them, these guidelines get updated every single year. So some things that may have been okay in the past are not going to be okay currently or in the future. So that's why you always have to be flexible to be able to read these, you know, every single year. But if you start reading them, you're going to start getting a good foundational knowledge, okay? So then we have our index. Now I'm going to tell y'all something. A lot of people get confused on this part too. I don't know how to look stuff up, Bleu. The best tip I can give you is to think of the action word. Think of the action word. If they're saying the patient has right leg pain, right? Right leg pain. Where is the action in that? It's not in the leg, right? That's just the location. You're not ever going to look something up based on the location. You're going to look it up based on the action word, okay? So that action word here in right leg pain is going to be the pain. So when you flip to pain, it's going to give you all of the options that it has for pain and the locations. And then that's when you can locate, okay, right leg pain. There we go. And then you can go back to the tabular and you can find the specific code for right side, okay? But that's what you're going to do. And that's how you're going to think of your diagnoses and how to look them up. You're not going to look them up by the location. You're going to look them up by the action word. I've always told my students this. You have to look words up by the action word. Don't try to look it up by the anatomical location, okay? You always want to look up the action word, and that's going to help you to locate your diagnosis that you're trying to find, okay? So here's all the index. Now, I have told people this too, and they look at me like I have 3 heads. Go through this whole thing at least once. And what I mean is look through all of the entries. You don't have to read everything, but just flip through it. Just flip through it. And you would be surprised how your brain is going to be like, we recognize this. We remember there's something about abrasions. There's something about, what is it? Abscess. So we know that this is going to be where we got to start looking. And so if you can kind of get that in your mind, trust me, guys, it's going to make things a whole lot better for you as far as your understanding of it. And you're going to get so much more comfortable with it, because that's why my books have never been tabbed when it comes to these coding manuals, because I've gotten so comfortable with them. And you can get comfortable with them too, because of course, when you're taking your exam, the name of the game is speed. And how do you get speed? By getting comfortable. So take a look through all of the entries that it has. Again, you don't have to memorize everything, but just take a look, just take a look through it and see. And you'd be surprised some of the listings that are in here. And you think, wow, there's a code for that? There's absolutely a code for that. And so, again, always think about your action word if you're looking up a diagnosis code, okay? So I'm going to flip through this really quickly here. It is a lot, yes, because this has every single diagnosis known to man. So, and then we have our neoplasm table. Okay, so here we go. And so if you need to look up neoplasms, this is where you got to go. And then we have, come on. Then we have our table of chemicals, right? I can't say certain things, so, but that's what that is. And then that's this here, okay? Then we have our external cause section. So this is all how did an injury occur? Where did it happen? What was the status of the person? All of that information is here, okay? So if you're looking up a fall, right? You're going to look it up back here in this external cause code section, all right? So again, take a look through here and see all of the different options that you have, because understanding that is really big. Now, here is the fun part, and this is why I love Optum so much. So here's the thing. Before this is your tabular section. Okay, you see all these colored sections here? This is all of your tabular section, right? Index, tabular. This is your guidelines broken down by chapter. So it starts off with the first chapter, and then of course it goes off to this next chapter here, okay? But look at this, guys. And Optum is the only one that I know of that does this, okay? So here we have the beginning of the guidelines, and then it gives you like the first part of the guidelines, and then it gives you a question right here. And so what you can do, and what I recommend that every student does, is you work through all of these scenarios that they have before every single chapter. You look up all of those codes so that you can do this for every single chapter. And if you've done that, that's going to get you a good foundation of, I know how to navigate in this book. Okay, so you cover up the answer and you look at the question, and then you can look at the answer when you've looked up the code, right? Whatever code you looked up, and then it'll give you the explanation. So it gives you rationale as well. And that's what I think is fantastic, because a lot of people say, well, Blue, I don't have anything to practice with. Why can't you practice from the book? That's why you got to practice from the book. So you go through and you look at this, and you will have gone through every single part of the guidelines in addition to reading it. So you want to talk about being ahead of the game. Most new students don't even know this, because there's a lot of schools that do not push this, especially those fast-paced schools that are less than 6 months, and they want to get you in and out. They want to sell you a dream and tell you, oh yes, you can be on your way after learning this for less than 4 months and, 2 months in some places. And, we can get you, going and you could be a medical coder. And these people have no idea what they're doing, because they were cattle herded through a school, and they didn't learn to go through the book and to practice and to cover up these answers and to go through them, right? Go through the questions, so that way you can start getting used to it. If nobody is there to help you, if your teacher is not helping you, it is not a reason for you to give up. It is not a reason for you to get frustrated and just throw it all away. Well, no one's helping me. This is something that you can learn on your own. And the book will help you if you're looking at the book, right? And again, guys, if you go through all of these scenarios here, and again, these are just the guidelines. So you can, if you're reading the guidelines, you can go ahead and just kind of skim over those, but at least work through all of the scenarios that they have here. Okay. And look at the rationale. And they have quite a bit, guys. So it's like a free workbook with your book. You know, if you're looking at it like that. And that's what gets me so happy about books, is because when you're looking at it, it can really help you. So you go through the first chapter, and then you do that, and then you can go through this next chapter. Cover up the answers, okay? You can do just like that. Somebody said that that was a great idea, and that they were going to have their spouse to cover them up with a sticky note. And hey, if that'll work too, so that way they didn't have an idea of what the answer was because they didn't want to look and, oh, they already know what it is. I'm just covering it up just so that y'all can see, you know, that it is possible to just cover these answers up and be able to work through them. Okay. So you look at the scenario, you see what they're asking you to look up. You go back to the index, and then you come back to this section to look it up. And then you write down your answer, and then there you go. There's no better way to learn this book than this method. Okay. So going through every single chapter before, see, like I told you, they're not going to have it for every single one because it's already covered, right? Because it's already covered under this, but it continues. But there's nothing for here, but that's okay. They still have it for this here. Again, you cover it up. And then this is going to give you all good practice also on the sequencing. Okay? So again, that's the best way because it's already in the book. So do that, guys. Do that. Cover these answers up. Work through them. If you don't get the correct answer, then that's where you know you need to go over it a little bit more. And if you really need help and you need a tutor, you need somebody to support you, go on LinkedIn. There's a ton of tutors on LinkedIn. My calendar is currently closed until September 1st. If you're interested then, please give me a reach out then. But right now my calendar is closed for tutoring. But there's a ton of tutors on LinkedIn. Okay, I'm just saying. But cover these answers up. Go through these, practice, guys. And you can do this for every single chapter. And that's just the beauty of this. And again, you got to keep your pages clean because these books are written by doctors and scholars. They have everything that they need in them. You just have to learn to trust the book. You have to learn to use the book. Because again, if you're using the Optum book, and see more of these little quiz exercises here. You can just cover them up and then you work through them and then you check your answers. Okay. But look at this throughout. And a lot of the code books have like the use additional notes, right? They have, what is this? Excludes one. So they have all of these notes here, but Optum goes a step further and gives you definitions. What do certain things mean? So they give you definitions. There's some coding tips as well throughout these sections here. Okay, you got to pay attention to these red little notes here too, where it talks about code first, underlying diseases and things like that. So it'll give you an idea if there's something else that needs to be added. So you got to pay attention to those. Somebody had asked me, well, Blue, when I look up a code, do I have to go to the guidelines to make sure that everything's okay? Sometimes it all depends on what the situation is. But a lot of times that answer is going to be right here already in the beginning of the chapter. So when you're looking at this, again, look at this. This is for Parkinson's. And it tells you, it gives you all the use additional codes. Okay? Use additional is saying use additionally. Not code first, because you'll see that code first in some places, and you'll see use additional. You have to understand what the two things mean. Code first means that one goes first. Even if you looked up the second code first, you got to code first if there's a code first instruction. Use additional means that you looked up this code, but you're also going to code these other additional codes if they're applicable in this situation. All right. I get very excited, guys, when it comes to these things because this is how you start building your knowledge. And this is how you start building, your common sense in this industry. So that's just what I'm saying there. So again, pay attention to those notes there. And then look at that definition. See, again, that's what I love about Optum, because, they do these great things to help coders. So again, here's more of these, right? More of these scenarios that you can cover up, and you can work through those. Work through all of these, guys. If you're working through all of these, oh, trust me, you're going to be so much more prepared. You're going to be so much more confident working with the book. It's those people that are scared of the book, or they're looking for those stupid shortcuts, or they're just trying to how do I hurry up and how do I crack the test and all this kind of garbage. Those are the people that get very frustrated when they can't find a job because they're not able to pass an assessment test, and they're not able to understand really what's going on because they haven't taken the time to really look through the book. And there's plenty of exercises here, guys. So many. Again, it's a workbook and a code book. So I'm running out of time already. So go through the entire section, and it's going to take you some time, guys. You're not meant to speed through this, but you are meant to get that practice. Look, your injury coding. A lot of people struggle with injury coding. I love injury coding. It's also going to give you tables like when it comes to like the muscles and tendons. So and throughout, there's really good anatomy plates and anatomy helps throughout this book. So if you are looking through your book, you're going to know where to go for these things to find, right? So when it's talking about like the shoulder, we're talking about these are all considered muscles: the infraspinatus, the subscapularis, the supraspinatus, the tres minor, and the tres major. So it's talking about all these, and this is considered an extensor tendon. So sometimes, and that is the posterior deltoid and the tres major. A flexor tendon is considered the anterior deltoid, and then other tendon. So sometimes there's a specific code based on whether it is a flexor or an extensor tendon or a flexor tendon. And so here, this muscle and tendon table is going to tell you what it is. So if the doctor or the provider has specifically documented the location, you can look here and see if there's going to be a specific code selection, whether it is extensor tendon or flexor tendon, okay, or other tendon. Because the doctors are not going to say extensor tendon or flexor tendon. Sometimes they will, but they're not going to do that because they automatically know what it is. It's on you, the coder, to understand. Again, how do we get those helps? We get them by looking through the book. And here's more: the lower leg, the ankle and the foot, the thigh, the hand, and look at all of that. It's all specifically broken down. If you are not taking advantage of these helps throughout the book, you're losing out, my people. Don't lose out, okay? Whatever you do, don't lose out. And use this book. Don't tab it up, guys. You don't need to. Because look, it takes a lot to get through this book without tearing the pages. But you start adding those tabs, and when you're trying to get through this book, it's going to tear your pages. And you cannot have tape. You cannot have staples in your book. Now, you may hear from somebody that says, oh no, I was able to tab all my book and they let me in. You don't want to take that chance. Do not take that chance, and do not go in there because your book is all ratted up and be like, oh, well, I'm just going to gamble, because that person may not allow you. If you're going into a place, they may not allow you to take that book in, and then you'll lose all that money. So don't lose money, guys. When I was coming up in medical coding school, they were really big about not writing, not tabbing, not highlighting, no tape, no nothing. And so that scared me straight. I was like, okay, I won't do that. And so they said you can have minimal writing. That, of course, it's about the code if you need to make a thing about it. But again, if you're looking at your book, you don't need to have all of those things. And so then here we get to the back. And this is one thing I want to show you before we get done with this video today. this is a valid 3-character ICD-10-CM codes. This is just a list of codes that are 3 characters. Some are not, and some need to be built upon. But these, you need to know for sure, these are valid 3-digit characters, okay? You don't have to memorize that, just as something for your reference. Here's your pharma list, okay? And it's going to give you the code. So if you know what it is, you know the thing that you're trying to look up, you can look back here in Appendix B and it'll give you the Z code, right? And it'll tell you what it is, what classification does it fall under, and the indications. So that's really going to help you because you're going to have to learn that. That is one thing that we as coders do have to learn is pharma. And then, of course, you have Appendix C, and this has all of the label names, all right? So that's also something that you can just look at. Look how small this section is, but it will also help you to understand some of the more popular brand names and what they are, the code that they fall under. So this is, again, another thing that you could be looking at to learn more. The HCC, if you're planning on doing HCC coding, this is what you need to know, all right? And this is what it's all about, and it's all just diagnosis coding. And you still have to understand your pathophysiology, I'm just saying. And then you have the QPP program, but here's all of the illustrations in the back. So if you're panicking about not knowing your anatomy or you can't remember everything, if you know back here, here's your anatomy plates. If you get stuck during your test, you can always look back here if you need to. Although there's not a lot of time, I will say that. So with that said, that's my video, and that's how you study with this book. You use the book, my friends. Use the book. All right, so with that said, I'm going to go ahead and wrap this one up. But that was my video today on this book. This is a great and wonderful book. I don't care what anybody says because it has so much to it, and it's very easy and very user-friendly. I'm just saying. So with that said, if this video helped you, please like, subscribe, and share, and I will see y'all next time. Bye.